Okay, thank you very much, Ropio Madzena. Let's take you back to Kimberley now, where most of the action has been in the last hour with the Health Minister, Dr. Zweli Mkhize, addressing that controversial tender of digital vibes. Let's take you back live there.
To look at what else we can do, because fundamentally, the Northern Cape, the real challenge relates more to the scarcity of resources, human resources, infrastructure, underfunding, as well as the long distances between the various centers, and the population that is so widely dispersed that it makes it very difficult to invest on the same proportion as what you do in other parts of the country. So I've been discussing the issue that we will then be looking at what can be available from the COVID-19 allocation which the province has been given, and then only if that situation needs any additional discussion, then we can look at that. But we would also want to work with the province to look at where they've got a budget but they've got a difficulty in attracting specialists, the nurses or the doctors. Then we work together to try and see if we can together try and source those, particularly for ICU, high care, because what you would need to do here is that you need to look at the various private recruitment agents that can make nurses available and see whether in fact that becomes helpful for the province. So that the conversation is needed between us to deal with that.
Minister, one last question from me. So we're moving towards a third wave. They said if we reach infection rate of 6,000 a day, we will be in the third wave. In terms of the Northern Cape, are we at the point where we can say the Northern Cape is already in the third wave, or are we still on our way, or are we there yet?
No. Northern Cape is on the third wave as a province. It's on the third wave, and it's been like that now for a few weeks. And that what was complicating this is what I was indicating. What complicated the Northern Cape is that the first wave was very broad, it tracked for a long time, and therefore it was exhausting a lot of resources, even human resources, even the fatigue. But when it went down, it never really reached the bottom trough where it should have been. So for a long time we saw the numbers in the Northern Cape not changing, and that was because the numbers kept remaining up, and we did say it had not gotten out of the second wave. Then all of a sudden it started shooting up after the Easters. So we are on the third wave in the Northern Cape, we are in the third wave in the Free State, we are in the third wave in the Northern Cape, in Northwest and Gauteng. But the country as a whole is not yet on the third wave, and the third wave will probably be coming up once you get the numbers in KwaZulu-Natal and Eastern Cape and Western Cape pushing up, but also if the Gauteng numbers are going to go up. Our models have shown that the Gauteng is the one that's likely to have much more numbers and a higher third wave than the rest of the country. So we're monitoring that situation.
Thank you, sir.
Okay.
Minister, it's Heidi again. I just have one question with regards to the Digital Vibes contract. There was a report in Sunday Times that you signed off on a contract. Can you clarify whether or not you did sign off on the contract? And if you did, as a minister, do you think that that was lawful?
I never signed a contract. And it looks to me like somebody didn't understand what signing was all about. What we have signed are the normal submissions, which would report to the minister that we have appointed a service provider, we have allocated the budget, we have done all the plans, we have done everything, and that must come from the activity manager, excuse me, to the unit manager. It must be countersigned by the Director General, and all that the minister is expected to do is, with that information, he should take note of the fact that there has been a plan, there has been a budget, that the administrative processes have been done, and that all the minister must do is to approve the communication strategy in this regard. So it was all about just that strategy. So when I signed, it was a normal memo. In fact, the investigating team didn't quite understand this, because then they raised the issue about the signing of the memo. Then we got a senior counsel to explain that in fact it was a normal memo, that there is no way a minister can actually participate in appointment of a service provider, allocation of the budget. That gets done by the administration. But once they've done that, the minister must have reasons if he refuses to sign that. So that's a standard way of how it works. And also, in this case, the minister did not participate anywhere in all the administrative processes. All that we've done is that the submission says, this is what has been done, can we proceed? And the minister says, we approve, proceed. So that is what the issue is all about. The report in the media about signing a contract is either, they misunderstood what was being said, or they were probably just mischievous. I'm not sure which is which. But the point is that there was no contract that has been signed. I've seen some analysts saying, oh yeah, Mkhize signed a contract. You must say, no, there was no such a thing. No minister signs a contract anywhere. Even with these contracts, I've been part of negotiating for vaccines. Those contracts, I negotiate and push and push. Once things settle down, the Director General has to sign the contract. In this case, we actually had to sign with the Minister of Finance and myself as Minister of Health to tell the manufacturer, we will not sign the contract. It shall be signed by the Director General. And all of them are like that.
Okay, Minister, just last question from me. You said you've been discussing with the President regarding special leave. Is there a time frame on that? And would you consider resigning if the President comes back and says you don't need to go on special leave? They've looked at the investigation, they found nothing.
Well, I think we shouldn't preempt any issues. The SIU report is still on its way. It hasn't come. So I don't think we should preempt that. Secondly, I don't also think we must second guess the President. I have been to the President. I've discussed the President 2 weeks ago. We've been discussing and so on. But obviously, there's been a lot of things that needed to be done. I just reported about the Johnson & Johnson, arrangement where we needed to get the additional doses and all of that. So the President has got all the time to decide how he wants to deal with the matter. In this regard, the President has actually discussed with me, I've approached the President on the issue of a special leave, and that's really all that the discussion has been all about. So I think we must not second guess the President, allow the President to take a decision. He's the head of executive. I've made sure the President is fully briefed on everything, and at any one time, if there's any issue that needs to be discussed, I'm always available. So I think we must give the space to the President to do what he needs to do, and then, of course, we take the issues from them. Thank you very much.
Thank you very much. We do need to go. I'm sorry. We really need to go. We really need to go.
The WHO said yesterday you don't actually need the FDA to make a decision for you about the use of the eNCA because that was a localized contamination. What's your view on that?
I don't know what that means. I've discussed with Johnson & Johnson. They say as far as they are concerned, they have no problem. They've analyzed the samples. We don't work that way. What happens, we need our regulator to say, you can use it. And the regulator must come back to us and say, we've discussed with the FDA, we've discussed with the European Medical Agency, we've analyzed the reports, we are comfortable with the fact that this can be used, then we are ready to use. Well, the vaccines are there. They're waiting for the past month and a half, they're sitting there. So, but it is not the manufacturer that authorizes the use, it is the regulator. We must allow the regulator to deal with the issue from that point of view. And so from where I sit, we actually had a meeting with SAPRA. I called a meeting with SAPRA, Johnson & Johnson together. That's when we decided the meeting must be held with FDA and SAPRA because they're the regulators. They must clear their issues and release the vaccine when they feel we need to get the vaccine. We're very desperate to get those vaccines. We need them yesterday. The whole country will make a difference. I've said 2/3 of all the people that need to be vaccinated are awaiting the J&J vaccine. Northern Cape, we designed it on the basis of Johnson & Johnson. We're very desperately in need of it. However, it is the regulator that must say, yes, continue, not the manufacturing company. Thank you.
All right, thank you. Thank you very much.
All right, thank you very much.
Dr. Zweli Mkhize, the Health Minister, they're finishing his media briefing. That took quite some time, and clarifying that, if you've just joined us, that the country, and I'm quoting him, is desperate for the Johnson & Johnson vaccine. He's met with the South African health regulator and he's urged them to meet with the FDA of the United States soon so they can sort out their issues and be able, therefore, to release the Johnson & Johnson jab and approve it for use here in South Africa. More news.